Pneumonia is a respiratory infection that inflames the air sacs in one or both lungs, causing them to fill with fluid or pus. This can make breathing difficult and lead to symptoms such as cough, fever, chills, chest pain, and difficulty breathing. Pneumonia can range from mild to severe and can affect people of all ages, but it is most dangerous for infants, young children, the elderly, and individuals with weakened immune systems. Pneumonia can be caused by various infectious agents, including bacteria, viruses, fungi, and parasites. The most common cause of bacterial pneumonia is Streptococcus pneumoniae, while viral pneumonia is often caused by influenza viruses or respiratory syncytial virus OSVRV. Pneumonia can also develop as a complication of other respiratory infections, such as COVID-19. Risk factors for pneumonia include age very young or elderly, weakened immune system, chronic lung diseases such as COPD or asthma, smoking, recent respiratory tract infections, and certain medical conditions such as heart disease or diabetes. Pneumonia can be acquired in community settings, community-acquired pneumonia, or healthcare settings, hospital-acquired pneumonia. Diagnosis of pneumonia typically involves a combination of physical examination, chest X-ray or CT scan, and laboratory tests such as blood tests or sputum culture to identify the underlying cause of the infection. Treatment for pneumonia depends on the cause and severity of the infection, but may include antibiotics for bacterial pneumonia, antiviral medications for viral pneumonia, supportive care such as rest, hydration, and pain relief, and in severe cases, hospitalization and oxygen therapy. Preventive measures for pneumonia include vaccination against common bacterial and viral pathogens such as the pneumococcal vaccine and influenza vaccine, practicing good hygiene such as frequent hand washing, avoiding close contact with sick individuals, and quitting smoking. For individuals at high risk of developing pneumonia, such as the elderly or those with chronic medical conditions, prompt recognition and treatment of pneumonia are essential to prevent complications and improve outcomes. If you suspect you or someone else may have pneumonia, it's important to seek medical attention for evaluation and appropriate management. Description about lobar pneumonia. Lobar pneumonia is a type of pneumonia characterized by inflammation and consolidation filling with fluid or pus of one or more lobes of the lung. It is typically caused by bacterial infections, most commonly Streptococcus pneumoniae pneumococcus, but can also be caused by other bacteria such as Staphylococcus aureus or Klebsiella pneumoniae. The term lobar refers to the specific part of the lung affected by the infection. Each lung is divided into lobes, with the right lung having 3 lobes upper, middle, and lower, and the left lung having 2 lobes upper and lower. Lobar pneumonia affects an entire lobe or multiple lobes of the lung, leading to localized inflammation and consolidation of lung tissue. Symptoms of lobar pneumonia may include sudden onset of high fever, chills, productive cough with rust-colored or blood-tinged sputum, chest pain that worsens with breathing or coughing, difficulty breathing, rapid breathing tachypnea, and fatigue. These symptoms can vary in severity depending on the extent of lung involvement and the underlying cause of the infection. Diagnosis of lobar pneumonia is typically based on clinical evaluation, chest X-ray or CT scan findings showing consolidation of lung tissue in a lobar pattern, and laboratory tests such as blood cultures or sputum cultures to identify the causative organism. Prompt diagnosis and treatment are essential to prevent complications and improve outcomes. Treatment for lobar pneumonia usually involves antibiotics targeted at the specific bacteria causing the infection. The choice of antibiotic may depend on factors such as the severity of symptoms, the patient's age and overall health, and local antibiotic resistance patterns. Supportive care measures such as rest, hydration, pain relief, and oxygen therapy may also be necessary to help relieve symptoms and promote recovery. With appropriate antibiotic treatment and supportive care, most cases of lobar pneumonia respond well and resolve within a few weeks. However, severe cases or complications such as lung abscess, pleural effusion, accumulation of fluid around the lung, or sepsis may require hospitalization and more aggressive management. Preventive measures for lobar pneumonia include vaccination against common bacterial pathogens, such as the pneumococcal vaccine, practicing good hygiene such as handwashing and avoiding close contact with sick individuals, and avoiding smoking or exposure to environmental pollutants that can weaken the lungs' defenses against infection. Description about bronchopneumonia. Bronchopneumonia, also known as lobular pneumonia or bronchial pneumonia, is a type of pneumonia characterized by inflammation and infection of the bronchial small airways and surrounding lung tissue. Unlike lobar pneumonia, which affects one or more entire lobes of the lung, bronchopneumonia typically involves multiple small areas or patches of the lung, often affecting both lungs asymmetrically. Bronchopneumonia is commonly caused by bacterial or viral infections, with bacterial pathogens such as Streptococcus pneumoniae, Staphylococcus aureus, Haemophilus influenzae, and Klebsiella pneumoniae being the most frequent culprits. Viruses such as influenza virus, respiratory syncytial virus OSVRV, and adenovirus can also cause bronchopneumonia, especially in young children and immunocompromised individuals. The infection typically begins in the bronchioles and spreads to the surrounding alveoli air sacs, leading to inflammation, consolidation filling with fluid or pus, and formation of small areas of pneumonia throughout the lungs. Symptoms of bronchopneumonia may include cough, fever, chills, difficulty breathing, chest pain, fatigue, and production of yellow or green sputum. Diagnosis of bronchopneumonia is usually based on clinical evaluation, chest X-ray or CT scan findings showing patchy areas of consolidation in the lungs, and laboratory tests such as blood cultures or sputum cultures to identify the causative organism. Treatment for bronchopneumonia typically involves antibiotics for bacterial infections and supportive care measures to relieve symptoms and promote recovery. Supportive care measures for bronchopneumonia may include rest, hydration, pain relief, oxygen therapy, and respiratory treatments such as bronchodilators or chest physiotherapy to help clear mucus from the airways. In severe cases or in individuals with underlying health conditions, hospitalization may be necessary for closer monitoring and more aggressive treatment. Preventive measures for bronchopneumonia include vaccination against common bacterial and viral pathogens, such as the pneumococcal vaccine and influenza vaccine, practicing good hygiene such as handwashing and covering coughs and sneezes, avoiding smoking or exposure to environmental pollutants, and managing underlying health conditions that may increase the risk of respiratory infections. Overall, early recognition and prompt treatment of bronchopneumonia are essential to prevent complications and improve outcomes. If you suspect you or someone else may have bronchopneumonia, it's important to seek medical attention for evaluation and appropriate management. Description about cavitation pneumonia. Cavitation pneumonia, also known as necrotizing pneumonia or cavitary pneumonia, is a severe form of pneumonia characterized by the formation of cavities or abscesses within the lung tissue. These cavities are filled with necrotic dead tissue, fluid, and pus, and they can vary in size and number depending on the severity of the infection. Cavitation pneumonia is typically caused by bacterial pathogens that have the ability to invade and destroy lung tissue, leading to the formation of cavities. Common causative organisms include Staphylococcus aureus, including methicillin-resistant strains, MRSA, Streptococcus pneumoniae, Klebsiella pneumoniae, and anaerobic bacteria. The process of cavitation occurs when the inflammatory response to the bacterial infection leads to tissue necrosis and liquefaction, resulting in the formation of cavities within the affected lung tissue. These cavities can enlarge over time and may rupture, leading to complications such as lung abscesses, pleural effusion, accumulation of fluid around the lungs, empyema, pus in the pleural cavity, or septicemia, bloodstream infection. Symptoms of cavitation pneumonia may include cough, fever, chills, chest pain, difficulty breathing, fatigue, and production of foul-smelling sputum. The presence of cavities within the lungs may also increase the risk of complications such as hemoptysis, coughing up blood, and dissemination of the infection to other parts of the body. Diagnosis of cavitation pneumonia is typically based on clinical evaluation, chest X-ray or CT scan findings showing cavities or abscesses within the lung tissue, and laboratory tests such as blood cultures or sputum cultures to identify the causative organism. Prompt diagnosis and treatment are essential to prevent complications and improve outcomes. Treatment for cavitation pneumonia usually involves antibiotics targeted at the specific bacteria causing the infection, often administered intravenously in hospitalized patients. The choice of antibiotic may depend on factors such as the severity of symptoms, the patient's age and overall health, and local antibiotic resistance patterns. Supportive care measures such as rest, hydration, pain relief, and oxygen therapy may also be necessary to help relieve symptoms and promote recovery. In severe cases of cavitation pneumonia, or in individuals with underlying health conditions, hospitalization may be necessary for closer monitoring and more aggressive treatment. Surgical drainage or resection of lung abscesses may be required in certain cases to remove necrotic tissue and prevent further complications. Preventive measures for cavitation pneumonia include vaccination against common bacterial pathogens, such as the pneumococcal vaccine, practicing good hygiene such as handwashing, and avoiding close contact with sick individuals, and managing underlying health conditions that may increase the risk of respiratory infections. Overall, early recognition and prompt treatment of cavitation pneumonia are essential to prevent complications and improve outcomes. If you suspect you or someone else may have cavitation pneumonia, it's important to seek medical attention for evaluation and appropriate management. Description about pathogenesis of pneumonia. The pathogenesis of pneumonia involves a complex interplay of various factors that contribute to the development and progression of the disease. Pneumonia can be caused by different infectious agents, including bacteria, viruses, fungi, and parasites, each with its own specific pathogenesis. However, the general steps involved in the pathogenesis of pneumonia can be outlined as follows. Entry of pathogen. The pathogen responsible for causing pneumonia enters the body through inhalation of contaminated droplets, aspiration of oral secretions, or dissemination from another site of infection in the body. Common pathogens include bacteria such as Streptococcus pneumoniae, viruses such as influenza virus, and fungi such as Pneumocystis jirovecii. Colonization and invasion. Once in the respiratory tract, the pathogen may colonize the mucosal surfaces of the upper respiratory tract, including the nasal passages, pharynx, and trachea. Some pathogens have specific virulence factors that enable them to adhere to and invade respiratory epithelial cells, allowing them to establish infection within the lower respiratory tract, including the bronchi and alveoli. Inflammatory response. Infection triggers an inflammatory response in the respiratory tract, characterized by the release of cytokines, chemokines, and other inflammatory mediators. This leads to recruitment of immune cells, such as neutrophils, macrophages, and lymphocytes, to the site of infection to combat the invading pathogen. Damage to lung tissue. Damage to lung tissue. The inflammatory response causes damage to the lung tissue, leading to disruption of the epithelial barrier, increased permeability of blood vessels, and leakage of fluid and proteins into the alveolar spaces. This results in inflammation, edema, and consolidation of lung tissue, impairing gas exchange and leading to respiratory symptoms such as cough, fever, and difficulty breathing. Exudate formation. In severe cases, the inflammatory exudate may accumulate within the alveolar spaces, leading to consolidation of lung tissue and formation of inflammatory exudates. These exudates may contain immune cells, bacteria, cellular debris, and fluid, contributing to the characteristic radiographic findings seen in pneumonia, such as airspace opacities and consolidation. Resolution or complications. The outcome of pneumonia depends on various factors, including the virulence of the pathogen, the host immune response, and the presence of underlying health conditions. In most cases, the immune system is able to control the infection, leading to resolution of the pneumonia with appropriate treatment. However, in some cases, complications such as lung abscess, pleural effusion, empyema, or sepsis may occur, requiring additional management and intervention. Overall, the pathogenesis of pneumonia involves a complex interplay between the invading pathogen, the host immune response, and the local inflammatory processes within the lung tissue. Understanding the underlying mechanisms of pneumonia pathogenesis is crucial for developing effective preventive measures, diagnostics, and treatments for this common and potentially serious respiratory infection. Thank you for watched my video. Please subscribe my channel.